Hi, I'm Dr. Hirdesh from heightincreaseinfo. So we have our patient who completed his journey successfully and he lengthened around 8.4 centimeter in bilateral tibia. So right now he's in recovery phase. He can walk, but his callus is in growing stage, so he cannot walk like independently. With crutch he's walking right now. It will take some more time to get complete recover. So he's going home. So we will know his journey, entire journey from starting to end, how he spent his day, how he spent his time in frames, and how is the overall experience. So what was your starting height?
Starting height, I was around 168 centimeters.
168 centimeter. Okay. And why you want to increase your height? Because 168 is a good number.
It is a good number, but still people are all tall and all that thing, and I used to develop some kind of inferiority inside of me. That's why, let's say, if there's a space for some more extra inches, then let's go for it. I was like, and that's why I did this.
Okay. So from how long you researching about this? Okay, I want to do this lengthening surgery kind of thing also exist?
Yeah. This surgery, see, I was not aware from long time. I just recently came to know about it before my surgery.
Okay.
I think, let's say 3-4 months prior to my surgery, I think I was just...
So you took this decision in just 4 months?
Yes, sir. I was aware that surgery is being done in India, and there are a lot of places going on around, and I was like, let's go for this one, because here physiotherapy and all are expert. I was under the impression that more than surgery, physiotherapy matters in this case. You see, surgery, anyone can do the surgery. They can break your bones and put some nails and all that thing, frames. But the main thing that matters is physiotherapy. That's why I went for here, and
the entire care on the one place. That's why I chose.
That's why I chose this one.
Okay. So when you came in India, what was in your mind because about the surgery?
About the surgery, I was pretty anxious.
Anxious.
In the initial days, anxious, afraid, because I did not know what was about to happen. But since I came here, a feeling of homeness I kind of got. That's why, yes, a lot of places in India, they were aware of this particular thing. They were doing surgery and all, but yeah, I came across few, but still this place stood out in my mind, this place, because the physiotherapists are experienced and everything is being done under the package, plus complications are being handled, and there are a lot of patients as well, and I met with a lot of patients before doing the surgery. I met with patients and I saw a lot of videos, and then I made up my mind.
So after the surgery, what was your experience with frame? How was your pain level and sleeping and spend a day in frame? I think you 3.5 months you spent in frame.
Yeah, somewhat of that time. Yeah, when suddenly there's like frames in my legs, alien objects, like it was like a little bit new to me, because legs were heavy obviously because of the frames. Not that much afterwards, but still in the initial phase and after the surgery, the frames were there, and movement, this kind of sideways movements were restricted. That's why I had to maintain the straight posture while sleeping in the hospital. Yeah, and eventually I became habitual day by day. It became, I got used to it, the frames, and movement slowly and steadily it began to cover up for that.
Okay. So after how many centimeter you faced any problem, like your muscle is stretching?
Yeah, see, in that case I had nerve irritation and all that in my legs after surgery. Yeah,
immediate after surgery or after certain lengthening?
After certain lengthening, I think. After certain lengthening, this legs used to heat up, and apart from that I used to have this muscular cramp also. Muscular cramp, the stretch in this calf muscle because of lengthening.
Any kind of thought came in your mind, so I should stop on 5 or 6, or you had your target, I want to go to 7 to 8 centimeter at any cost?
Yeah, that was my target, and see, initially I made up my mind that there will be physical pain and mental pain obviously, and I have to get used to it, I have to deal with it. I thought of
this is very important.
This is very
mentally preparation.
See, physical pain can be managed by painkillers and all that thing, but mental pain, there is no medicine for that. You have to make up your mind by yourself. There are medications and all that, but still sleep cycle will be a little bit disturbed, and it won't be the same like before.
So have you did any kind of preparation before surgery? Because your muscle flexibility is very good. You lengthen 8.4 centimeter without any ballerina, without any minor complication also.
Yeah, a little bit somewhat. Yeah, I used to do sports and all that, trekking, hiking and all that, swimming. I used to do that, I think, because of that. Stretching, particularly stretching, I did not used to.
See, only stretching part we can do preparation. Otherwise, bone formation is not in our hand, not in your hand. That is your body regeneration. But still your callus is growing good. Hopefully within 1 month or 2 months you can walk independently also. You can right now, but we don't allow.
Yeah, so yeah.
Okay, so you want to give any suggestion who want to do surgery after, so before surgery, what preparation you did? Because your experience is good. Without any ballerina, you completed even more than 3 inch.
That, yeah. So before surgery, try to do few more stretches and all that. Try to be flexible, do that hamstring and all that thing, so that your what do you call it? This upper leg and lower leg muscles in the upper leg and lower leg will be a little bit more stressed out, and it will be easy for you during the distraction phase. Since my calf muscles were very tight initially before the surgery, I had that stretch pain while doing the distraction from the frames, and yeah, there was that. So few things I've regretted, that if I would have done this pre-surgery stretching and all that thing, then it would have been fine. There's a video in the channel as well. You can watch that and do that stretching at least, not at least, but let's say 1-2 weeks before prior to surgery.
1-2 month, I think week.
Yeah.
It doesn't work.
1 month, at least 1 month before. If you do that, then it will be very easy for you. Your journey
During lengthening, your journey will be easy if you follow that.
Yeah, during distraction.
Now we'll talk about after frame removal. How's your journey?
After frame removal, see.
Because rehab part will start, main part start after the frame removal.
Yeah, the main part after the frame removal, yeah. Because I was getting used to the frames and suddenly it got removed, and my legs were feeling light. I was feeling that it is like paper light. My legs were like paper light. But slowly and steadily the muscle began to come due to that gym and all that, I think. Muscle began to come. Now it's pretty normal, and I think I can stand up and walk, but
So after frame removal also you feel any kind of pain?
No, after frame removal, the only thing that has been bothering me is the
Screw part, distal screw part.
distal screw part. Yeah, it's slightly popping off, I think, and other than that, there is no pain for me. Sometimes you can feel that a little bit numbness over here because of this stretch, I think.
But it's just settling down, huh? This will.
It's settling down, yeah.
Okay. And how's your rehab going? You're doing all the exercise. Is there any difficulty you found?
No, exercises difficulties there is not, but while walking and while wearing the brace and while
PTV brace, that's for support because you don't have enough callus.
yeah, while walking with that, a slight discomfort and pain is generated in this distal area.
Because there is no connection, callus, there is no bone connection. Once your breath formed, then you will feel much better.
Yeah, there's a big gap in the bones, yeah, that's why.
Okay, and are you satisfied with your height right now?
Yeah, see, since there is more space in my femur, I'm thinking.
Can go further, eh?
Yeah, I can go further, but right now I'm pressed in time and somewhat.
So do you think this is worth it? This much pain, time, money?
It is worth it, obviously, because you'll get taller and you'll be able to increase your self-esteem and personality will be changed. No, before you were short, and because of that you were feeling inferior. You're feeling like you were less in terms of.
This thing like permanent.
Yeah, this is the permanent thing. Yeah, so all the pain, it's worth it.
It's worth it. And you want to say about height increase info overall journey from starting to end?
Yeah, overall journey has been fine for me. Yeah, it has been fine. From the surgery day, they have handled me pretty well, and the physiotherapy sessions and all that. It has been extremely good for me. And after that, since I do not have any complications apart from this screw popping out a little bit, I think this will also be settled as soon as I get the callus. Apart from that, journey has been pretty fine for me. Everything, food and helpers and all that, it's been good.
Okay, so best of luck for your future. And he's still in recovery phase. This will take, I think, 1-2 more months.
Yeah.
After that, you can walk independently. Independently, still you're doing, but you're doing with
crutches.
With crutches. So this is his journey, and maybe we will post once he fully recovered. He can walk on his feet independently without any aid. So till then, if you have any query regarding limb lengthening, limb reconstruction, you can ask. Number is given below. Thank you.